All right.
Let's see. So let me ask, because I don't see where it asks me to let people in from.
I see people joining, so
Oh, good.
maybe
Okay.
we want to wait for a couple of minutes until
Yes.
people
Yeah, it
come in.
wasn't, I didn't see the option of allowing people to join in from the, there we go.
Yeah, we have more people joining.
Yeah. Hi, everyone. We're just giving it a couple minutes to let everybody join in.
Hello, everyone.
There you go. Yeah, maybe we'll give it a little bit longer. Oh, there we are.
Hi.
Hi, Maria. Thanks for joining. Yeah. Did you want to give it any more time, or should we get started, I guess?
It's up to you. I guess we can get started, and then people can still join in, right?
Yeah, yeah, they
Okay.
can come in as they sign. Yeah, we have more.
All right. Let's do this.
Okay. So good afternoon, everyone. Thank you for joining us. My name is Jillian Avendano, and I'm the program director at Florida International University's Center for International Business Education and Research, or CYBER. And like I said, I'd like to thank you all for joining us today. This is our second webinar in our webinar series, International Content Expansion. And the topic today is a very interesting one. It's data analytics and artificial intelligence post-COVID-19 and what it means for the classroom, but with a special emphasis on the healthcare and healthcare in Latin America. So I'd like to introduce our speakers today. We're very lucky to have Dr. Lina Bouayad. She is the FIU professor with the ISPA department, and she's a specialist in information assurance and artificial intelligence. And we also have Daniel Branco that is joining us, and he is a digital health entrepreneur and a CEO of Medicina Brazil. And go ahead, take it away.
All right. Thank you so much, Jillian, and thank you very much, Daniel, for joining us.
Thank you, Lina, for inviting me.
Great, great. So today we will start by talking a little bit about digital health. So we'll try to talk about digital health in the US and abroad. So my first question to you is, what is your experience with digital health? So before the pandemic, how did it start? How was it going?
It started long ago, before anyone talked about digital health. I actually developed the very first medical website in Brazil back in 1995.
Oh, wow.
So it was an atlas of human histology. Uh, 95, 94 was the period of time where the first graphic internet websites came up. So I was there already developing content for healthcare. By 1999, I had developed a website to allow people to make questions on healthcare and doctors and medical students to answer. At that time, I was a medical student, so we answered like hundreds of thousands of
Oh, wow. So
questions. Yeah,
that was an early age health community, right? So you have patients,
yeah.
but then it was only doctors responding and medical students, or did you allow the patients to respond as well?
No, only doctors and medical students was the model for the specific website
That
back
is
in
great.
99. Yeah, and it was a time before Google, so there wasn't Dr. Google like there is today. People
Wow.
talk about a lot about Dr. Google and how you can get any kind of healthcare information online, right?
Uh-huh.
So yeah, it wasn't the case at that time. So it was like a very innovative. so to speak. Then between 2002 and 2001 and 3, I created one of the very first EMR systems that was totally on the cloud. And that was a time before cloud was a thing. Like cloud was just like something in the sky. It was not like an IT thing. And that venture did pretty badly because the other ones did well, but that did pretty badly because the doctors were not used to even use the internet. They didn't have internet connection on their offices.
So was it the infrastructure you think that was the main challenge, or was it the doctors that were not tech savvy and did not want? Okay, all right, because here in the US, we're very familiar with medical practitioners not wanting to use technology. So that's a very familiar issue that we have right here. But you're saying that the infrastructure was a problem as well.
The infrastructure was a problem for many places. And when they did have internet, sometimes they have to dial in, like those kind of internet connections. And also they were very suspicious of letting medical data to go online. So they were used to have those patient information on their computers in the office, right? So that's
a very good point. Let's keep that one in mind, and we'll talk about it a little bit later during the presentation.
Yeah, okay. And well, then I stopped doing that for a while. I became a neurologist and was doing research in brain mapping, which is digital health kind of, but not the type that we're talking here. And eventually I came back to be an entrepreneur again in digital health in 2012. That's when I founded Medicina in Brazil, which is a CRM platform for hospitals.
Okay. So how is that related to telehealth? And can you tell us a little bit about telehealth before and after the pandemic?
Yeah. So 8 years ago, when we started, telehealth was prohibited in Brazil.
Oh, wow.
So
okay.
Yeah. The idea
so you mean you were not allowed at all, or it was just not reimbursed for the doctors?
Yeah, it was definitely not reimbursed. But it wasn't illegal, but it was, the doctors were not allowed. So it's not like the doctors could lose their license if they practice telemedicine, telehealth.
Okay. Oh, wow. So they could even lose their license if they practice telehealth?
Yeah, they'll have to go through a process, like they'll be, I don't know, in the end, they'll not go to jail because it was not illegal. Actually, the government was trying this whole time to push telemedicine because Brazil is a super big country. It's like, it's bigger than the contiguous states of the United States. So it's big. And there's a lot of concentration of doctors in São Paulo state and Rio state, the southeast states, meaning there's a lack of doctors throughout the country.
So there is a need.
There was a big need. The government wanted to push it. A lot of the society wanted to have that, but the doctors were resistant. So they weren't able to make telehealth illegal, but they were able to go after the licenses of doctors who did it.
I see.
Yeah.
Okay, and then the pandemic happened, and then what?
Then the pandemic happened, but we lasted for 8 years before the pandemic, right? As a telehealth kind of company in Brazil, which was very challenging.
Wow. So how did you manage to make it work if it was not allowed for doctors?
When we realized that the regulation was not going to change anytime soon, we turned the company into a CRM kind of a platform.
Okay, so it was doctor to doctor.
No, instead of being a customer relationship management platform, which like companies hire to help them manage their customers, we developed the concept of a clinical relationship management. So the platform allowed the hospitals and health systems to stay connected to their patients, but not to do what's the most valuable of all, which is the consultation, the visit, right?
Okay,
we
so
did a
no
lot of
consultation, but they could
administrative.
still communicate with their patients.
Yeah, so a lot of administrative reminders, check-ins, everything that happens along the patient journey, which is not really a consultation.
I see. Okay.
Right?
All right.
Yeah.
Great.
And then the
Okay.
pandemic came. Yeah.
All right. And then what
everything
happened?
changed. Well, then the whole medical establishment was like flooded by demands of patients that couldn't go to the office anymore, just like it happened here in the US.
Yes, exactly.
You
So we
happen,
went
right?
from about 900 telehealth consultations a day to about 19,000 in certain
Yeah.
areas.
So we went in Brazil from 0 to thousands. I don't know how
Wow.
many thousands, but certainly thousands. But we went from 0 to that. So in our company, we had uh, to build a telemedicine platform, which was not really our thing because we are not doing video stuff. We're more doing chat and alerts and those
I
kind of
see.
things.
Uh-huh.
And all of a sudden, we had to develop a telemedicine, a video chat kind of platform. And on top of that, build the team to provide the visits because in most cases, the institutions were not ready to do it themselves. So we did that in like 2 weeks, was like
Wow.
super fast.
So
And
you had to adapt.
yeah, pretty quickly, yeah.
That's great. That's wonderful. And these are examples of companies that can thrive. So those are the companies that can adapt in situations like this,
yeah.
and just move where the demands take them. So this is wonderful. This is great. So can you tell us, so you just mentioned a little bit, you moved from alerts and chats to now video. What else were you able to offer? How about prescriptions? Were you able to do prescriptions on the platform?
That's a good point. So just when we started our company like many years ago, other companies started as well to solve the prescription thing, to solve the prescription process. And they were like us, they were like in a limbo, like they were for this whole time, these companies, they were like formularies kind of companies, but not really doing any prescriptions, but mostly telling doctors what was available for them on the market, so they could prescribe their patients, and like bringing all those information about the medications and everything. And after COVID, they went through a very similar process as ours, and they started providing the actual prescription. And there was in many.
Go ahead.
In a certain way, it was trickier because for the prescription is a document, and a document that has to be signed, and the whole country was not ready for the digital signing kind of thing. While the e-visits, the online visits, there was a challenge from a technology perspective, but we didn't have at least to
the trust
integrate.
Issue.
Yeah,
right?
we didn't have the signature issue.
Yeah, the trust and security problem. It was mainly a technology problem. Okay.
Yeah, we had the standard security problem, I'll say, which is like making sure that the data was safe. But but in Brazil, for a signature to be valid, it has to go through a government system, which is complicated. So like to validate that a signature is valid. Which is something that we are discussing how it works here in the US, which is there's no government involved, I think, but I think it's not quite secure as well here. There's like a
Well, I believe here what's going on is that the prescription is done through the system. So the EMR at the doctor's office is connected to the system of the pharmacies, and the prescription can go directly from the EMR system at the doctor's office to the pharmacy. So we don't have the patient in the middle. So there is less opportunity for fraud. Nonetheless, we're not saying that we don't have fraud and waste and abuse in the healthcare in the US, but the technology is a little bit more advanced. And I believe that helps us to avoid the signature problem on the prescriptions.
Yeah.
So
So in
now,
Brazil, yeah.
yeah, so in Brazil, you still need that prescription to be signed before it.
So yeah, before it had to be paper-based and signed
Uh-huh,
with the pen, right? And the patient will take that to the pharmacy. And like the
uh-huh.
pharmacy wouldn't have any information in advance from the doctor. And now with those systems, which is not something that our company does because there's no need. There were other companies already working on that on those things. So today, doctors can prescribe electronically, and the prescription is sent to at least a few pharmacy chains in the country.
Yeah. Okay, well, let's talk a little bit. So now we know we have a little bit of an idea of the entire picture and how digital health started in Brazil and how it compares to the US a little bit. But now I want to switch gears and talk a little bit about analytics. So the technology, data analytics, how do you see us moving forward? So I know that we started with pen and paper and having all the documents on paper at the doctor's office. And now we have EMR systems, and we even have doctors talking to each other. But then what's next? Do you have chatbots talking to your patients? What do you have currently, and what do you envision for the future of telehealth?
Yeah. So, well, that depends a lot on the vision of every different entrepreneur, right? Because they're the ones that are building this new reality, including myself. In my case, what I anticipate is a lot of I anticipate the hospitals and the institutions happening inside the patient's homes. Kind of. Let me just try and make it clearer because and one particular change that I anticipate is that up to now, healthcare and health in general, medicine was very reactive. So as I'm talking, I haven't practiced for 15 years now, but I still remember how doctors are in Brazil, and even and I know as a patient here in the US that the doctor will never come after you. It's always you who has to go after the doctor, right? When I was in medical school, I was even taught to raise my chair and like make it so I would feel more important than the patient. And there was like this whole asymmetry between doctors and patients, which was very ugly. Like and that's changing. That's changing a lot. So the asymmetry is changing, and the asymmetry was pretty much based on knowledge, and the knowledge gap is also decreasing. So patients know a lot about their conditions if they want to. They have the resources to go after and learn about their own medical situations. The reactive versus proactive thing is also changing a lot. So I don't think it will be the case that doctors and hospitals and the whole health system will be waiting for the patient to show up. They will have to go after proactively after the patient and make sure the patient is well.
Great. So this is
So that's
wonderful. So yeah, so this really wraps around the patient-centric healthcare, preventive care. So we are seeing a movement towards preventive care rather than waiting for the patient to get sick. So we're actually advocating for health care, not like the sick care, right? We don't want to wait until the patient gets sick before we get to help them. We want to prevent that disease from happening. And I believe that that's exactly where the technology comes in. So today we have sensors that we can place at the patient's home to measure the temperature or monitor the temperature. We have devices that monitor the heartbeats or the glucose level. We have automated chatbots that can talk to patients, answer their questions, or even remind them to take their medicine. Do you have any of that already installed, or do you envision that to be incorporated in anytime soon?
No, that's all going to happen in Brazil, right?
Oh, wow.
And even in the US, even though all of those things were happening because of the whole entrepreneurial environment here, and because regulation allowed it to it gave it more room for those entrepreneurs to flourish. I think even here it's gonna change to a whole new level. Like you're gonna see uh, healthcare really happening remotely, not only like measuring a few physiologic variables like a temperature or pressure. A lot of healthcare is gonna happen from the home, and
Yeah.
because there, for many years we were having this talk about the hospitalization, like people using hospitals less and less, or staying shorter periods of time in the hospital, right?
Mhm.
Uh, there was much more talk than reality, right? You can always point to things that are going on, but in reality, it was like it was before. Things were changing too slowly, and now things are going to change much faster. That's my understanding of what's going on. I'm
Yes, and every.
involved with a Yeah, I'm actually involved with a startup in New York called Ponto Care, and Ponto Care is all about that. It's the company is doing exams that people are not being able to do in the hospitals anymore. Like
Uh,
take it not only those variable, those physiologic metrics, but take it, for example, EKGs or ultrasounds or things that usually you for sure you have to get out of your house or your home and go to somewhere to facility, to a medical facility to have. And now we are allowing those things to happen at home as well.
yeah.
Uh,
Well,
so
this is great. So we have hope for the future. So you believe that here in the U.S. and in Brazil, we're going to see a lot more adoption of these technologies moving forward, correct?
oh yeah, yeah.
All
The
right.
patient is definitely going to be much more empowered.
All right, wonderful. Well, thank you so much, Danielle, for joining us. Thank you. This is great. So right now, you're welcome to join us and stay with us for the rest of the presentation. And I'm sure we have some questions. Students are going to ask you some questions.
Okay.
Um, but right now, what we will be talking about is more of what is that technology about? How does it work? What does it do? The state of the technology, and then what are the limitations with those technologies? Is it perfect? Is it great? And if not, then how can we fix all those problems that are related to the technology? And how can we do that in the classroom? What's our role in the classroom? What should we teach our students? So with that, I'll switch back. I see that there is a question here. I believe this is a question for you, Danielle, on the chat.
Okay. I'm not able to see it.
Oh, okay. So it says this is new technology, but too many rollbacks like, I'm sorry. Let me see here. I'm trying to read the question to you. This is not a new technology, but has too many rollbacks, like Mr. Branco said, from infrastructure to technology standardization. My question, how do you feel nowadays is telehealth doing in USA, because there are too many uncertainties from government to practitioners and from MSP to doctors? Do you know if USA is on top of all these regulations to have more MSP working with doctors to regulate, have data security, have better technology standardization? I think this is a great question. So, and I think you touched a little bit on that, Danielle, when you said that you believe that moving forward, the telehealth will expand, and we're seeing an acceleration of the adoption of telehealth. And also you mentioned that regulation is a big issue. And here in the US, there has been a bill for several billion dollars to expand telehealth. So yes, these technologies will be adopted a lot more in the near future. And you touched on a great topic here, which is data security, which we will touch on a little bit later during the presentation. So data security is a big problem. Standardization is a big problem. And I believe that we're working on that. And those are some of the challenges that need to be addressed before we can see a full-blown telehealth proactive monitoring in place, right? Franco, do you have any?
Yeah, yeah, I agree with that. I think the US and also England were started ahead in terms of liberating and telemedicine, telehealth, comparing to other countries. I don't know much about other countries. I know about Brazil, and that's for sure. Actually, that was one of the reasons I decided to move to the US, because I felt so constrained there in terms of the things that I was able to do in Brazil. And that's not the case anymore right now after the pandemic. But I think regulation and healthcare always move slowly. Those are two things that really move slowly: healthcare and regulations. But as far as I know, the pandemic put us on a better track, at least when it comes to allowing more to happen remotely. So I'm optimistic regarding the possibilities for a near future. Yeah.
All right, wonderful. All right, so now let's delve a little bit more into the analytics and see what's in store for us. So what do we have right now, and what do we expect in the future?
Okay, I'm going to turn off my camera and mic, but I'll stay tuned if they have.
All right, thank you so much. Thank you again, Daniel.
All right, perfect. Thank you, Lynn.
Thank you.
We appreciate you.
All right. So, so here I just want to talk a little bit more about the analytics. What is AI, and what are the types of AI that we have today, and how do we see that moving forward? So the way I see it is we have two different camps. We have predictive analytics and we have prescriptive analytics. And we're going to talk a little bit about each one, and we'll differentiate between each one, see where we are. So as far as predictive analytics, these are the tools that allow us to make predictions. What we do is we use data, we use prior data, we use historical data, millions or billions of records from patients, and we give that to the machine. And the machine learns to extract patterns, and it helps us detect or understand what's going to happen in the future. One example of that is the algorithm that was built by Google that claims that it can detect metastatic breast cancer within the imaging, right? So that's something that we can do now from the analytics. So from the data, what happened was we feed millions of imaging records to that algorithm, and then we let it learn. We learn the difference between cancer and non-cancer, and then we let the algorithm tell us or detect if there is any cancer. As far as prediction is concerned, we have another algorithm, again by Alphabet, which is a company owned by Google as well, that claims that they can predict kidney disease up to 48 hours in advance, which is amazing. This is great accomplishment that has been released early last year. And if that is applied in the practice, then just imagine how many people we could save. If there is a patient with kidney disease, if the algorithm tells us that, hey, you are at high risk of getting a kidney failure in 48 hours, well, we can do something about it. And this is what Danielle was talking about related to being proactive. Okay, so these are tools, these are algorithms that help us to be proactive, to help us to prevent that kidney disease or that kidney failure from happening, right? So those types of algorithms are very helpful to improve health outcomes. Now, we see this a lot happening right now. So right before the pandemic, we had several hospitals that are using predictive analytics to predict or to set up or identify the risk for patients, to predict any diseases that are coming up in the future. And those are currently, or right before the pandemic, they were already running at hospitals. And hospitals are eager to use these algorithms because, one, it helps to improve the productivity of their practitioners. Two, it of course helps with the patient's outcomes. And with that, the most important is we're improving health outcomes of the patients, right? So, and whenever we improve the health outcomes of patients, we can reduce the cost. Right? So bottom line, everyone agrees that these tools can be very, very effective in the practice. And we can see here that one example in Tampa General Hospital where the CEO mentioned that they were able to reduce the cost by $10 million after having that analytics center for a few months, right? So this is great, and we were moving in the right direction. All of this happened right before the pandemic. Now, with the pandemic, like Danielle mentioned, we've seen a lot more happening. We've seen an acceleration of adoption of these tools and adoption of AI in general. And examples of that, we have seen chatbots being used here in the US. So for you asking about what's going on in the US, we have seen chatbots being used to answer or to automate responses for to patients. We have seen the use of text analysis and AI to automate the provider documentation. So when you go to the doctor's office, you notice that the doctor is always typing, and that reduces the eye-to-eye contact, and it reduces the overall quality of your interaction with the doctor. Well, right now with AI, what we can do is to automate that documentation. So as you're talking to your doctor, the algorithm is listening, the algorithm is transcribing, and the algorithm is pulling the most important information and putting it into the documentation for your claim to be sent to the insurance company. And that way, the doctors can focus on their interaction with their patients during the consultation. Also during the pandemic, like Danielle mentioned, we've seen a rise in telehealth, which is video conversation or video consultation. And with that, there are several companies that have implemented intelligent cameras. Those intelligent cameras, what they do is they, in real time, they take the images and the video and the recording, and they analyze that data in real time and provide information or provide knowledge to the doctor. So for example, if the patient during the session seems off, or the patient seems depressed, or the algorithm is able to pick that up, right, and give alerts in case the doctors didn't. Also, what we have seen is a lot of use of social determinants of health. So today, again, going back to being proactive, going back to being preventative, to preventive medicine, what we are trying to do is to look at the patient as a whole. What we are trying to do is to incorporate all the information that we can get from the patient or about the patient and include that in the healthcare, or include that to be proactive and proactively prevent any issues or diseases from happening. And with that, what we can do and what is currently being tested in research is using the data from social media, using data about transportation, using data about food insecurity. All of that we can pull and we can use and integrate with the patient record to be able to have a better understanding of what that patient is suffering from, and we can therefore help them better. And right now we have a lot of several insurance companies that are reimbursing this type of care. So care that takes into account the food insecurity, that takes into account the occupation of the patient, that takes into account the living standards of the patient. So all of that is being right now accounted for, because even insurance companies, they realize that if we can address those issues, if we can help the patients be there to their visit annually or every 6 months, we can prevent their admission to a hospital. We can prevent kidney failure. We can prevent the stroke. We can prevent the heart attack. And that would save them a lot of money, right? So all of this is getting together in one big picture, and with the technology and AI being the enabler here, we are on the way to provide better care, reduce or improve productivity for our practitioners, and we are definitely moving forward in healthcare. Now, all of this is great, right? So what we are saying is AI is helping us so much. It's helping hospitals predict any failure. It's helping us to detect or to set up risk levels for our patients. It's helping us to better interact with the patients. So all of this is wonderful. Now, let's talk a little bit more about the challenges. It seems in reality, or in theory, it seems like this is the perfect answer, but there are some limitations, and we have to talk about them, and we have to address them in some way. So let's talk a little bit about the limitations. And in here, it takes into account the way that these algorithms work. And right now, what I'm going to be talking about is the state of the practice. What are these algorithms doing today? What are the limitations of these algorithms today? And this is very important to understand from a student perspective, from a practitioner perspective, and then also from an educator perspective, right? So from a practitioner perspective, whoever those practitioners, those doctors who are using these tools in the practice, they need to understand that there are limitations, that these algorithms today, they're not perfect, right? And they need, there are ways to address these limitations. And for the students, we need to know that these algorithms are not perfect. We need to work on improving these algorithms and designing the better algorithms that would help us more in the future. For the educators, we need to stress on the fact that our students need to be able to present not only the benefits of AI, but also the risks that are associated with AI. And this is very, very important. Whenever we're teaching our students about AI, we need to teach our students about the benefits as well as the risks. So let me just, I'll talk a little bit about each one. So I just picked a few examples here for you for each type of analysis. And then I'll talk a little bit about some of the issues. I just picked some sample issues, and then how we can address them in the practice, and then how we can help in the classroom. All right, so with text analysis, so whenever we're talking about chatbots, and from your own experience, you might have observed that those chatbots are not perfect, right? So they are only helpful, for common questions. So for routine questions that are being asked, these algorithms work very well, right? However, we need to understand that these algorithms are not yet able to generalize, all right? So if we have a question that always comes up, for example, can I get an appointment for next week? So the answer would be, yes, these are the days or the times that are available for you. Now, maybe if the patient asks, can I get an appointment in 6 months? Then the algorithm is not able to address that question. So that's something to keep in mind. Now, how can we address that in the practice? For the practice, what we do and what we tell our practitioners who have these tools installed is, once you have them, once you put the tool and you have it on your practice, what you would need to do is to make sure to train it on more data. Make sure when you give that data to the developers who are customizing the tool for you, make sure you have a large variance of questions, because again, the way these algorithms work is that they learn from prior data. So the more data you give, the better. And then also, it's not only about the volume of the data, but also the variance in that data. Make sure to include every single type of question that can be asked by a patient and how that algorithm should respond to that one. All right. Also, another sample issue is different responses generated by different models. We have to understand that AI, yes, is a big umbrella that incorporates several algorithms. So there's not one algorithm and their AI or one method. We use several different algorithms. Sometimes we use ensembles, meaning we use several algorithms at the same time. And we need to understand that some of the algorithms might generate different responses. So we have to be very careful. If we're using different models or different tools for the same practice, that could be confusing to the patient. So if we're tackling one specific task, let's try to use one tool or one algorithm. All right. Difficulty to assess accuracy. So with these chatbots, again, when a medical doctor is acquiring one of these tools and they talk to the representative, the company who's selling this tool, what they could hear is, we have a 98% accuracy that this chatbot would understand your patient's questions and be able to answer accurately. Well, this is great, but how was that accuracy measured? On what data? How was it measured? If you are a cardiologist, was this tested on cardiologist questions or questions to cardiologists, or was it measured on questions to primary care providers? Right? So, and there's a huge difference between the two. So we need to make sure that that whenever we are evaluating these tools, we are using the correct data, and we need to understand how that tool was tested, where that accuracy number was pulled from, and then preferably try to test it internally, right? So whenever we are testing, so if somebody says, okay, this tool can give us a 98% accuracy, can we test it in-house? Can we test it at our practice, give it our data, and then can we measure the accuracy then? All right. All right, for our educators, what does that mean? Well, for one, like I mentioned, we need to understand the limitations of each algorithm, and each different algorithm has its own limitations. So if you're taking a data mining course, make sure to, as a student, make sure to look for the limitations of every single algorithm. We don't want you, so as business students, we do not expect you to be able to write the code for every single algorithm, but we need you to understand how the algorithm works and what are the limitations for every single specific algorithm. All right. And then we need to present the benefits and the risks that are associated with every solution, as I mentioned. All right. Also, like I mentioned before, we need to emphasize the importance of testing locally. Again, because these algorithms are not able to generalize to all the data. So whenever we have a tool and it's been tested in-house, we do trust that people do test these tools, but they still need to be adapted. They might still need to be customized to the needs of each specific doctor. So they need to be tested locally. And that's something very important to learn as well. So when we're teaching in the classroom, we can teach, it's very simple to show that one algorithm would perform really well in a specific data set, but as soon as we apply it to a different data set, that algorithm may perform very, very poorly. All right, so our next sample is image analysis. So in image analysis, what we have is the problem of precision recall. So in some tools, and right now we have a lot of intelligence cameras, like I said, in healthcare, also in security, at hospitals, we have seen adoption of these intelligent cameras. Why? Because we want less personnel on site. So instead of having security personnel on site trying to detect any abnormal behavior, what we're doing is we are trying to move towards using intelligent cameras that use AI for image analysis and movement analysis. And we see an acceleration of this adoption of these types of cameras right during the pandemic. Now, the problem with these tools are great, right? So these tools allow us to monitor, allow us to detect abnormal behavior without a human being without people being in contact with each other, and therefore reducing the risk for infection. And even later on, I mean, that would be a huge reduction in cost if we're able to have these cameras ready and available in different settings. So from campuses to airports to hospitals, these cameras can be really, really helpful. Now, the problem is these cameras can be very highly accurate. So for example, they can detect an image of a gun with a 97 or 98% accuracy, and that's what I've seen in several of the presentations. Now, the problem is, what about that 3%? What is that 3% error going to cause us, right? And what does it mean? Is that a false positive or is that a false negative? Does that mean when we miss, right? So when the intelligent camera gets it wrong, does that mean that we have someone who has another object that is not a gun, but then the camera raised an alert that was a gun? Or was it the opposite, right? Was it that someone did have a gun, but the camera missed that, right? And the two are completely different, and the way we can tackle each one is completely different. So we need to be very careful and understand what are those measures. So when we say we are missing that 3% error rate, is it in false positives or is it in false negatives? And that's very important, because once we know that, we're going to know how to handle that. We're going to know how to mitigate that risk in the practice. Okay, so if we know that our camera at the airport is not able to detect certain guns, then we might need to have a human still in place to help the camera, right? Or if it's the opposite, so if the camera is able to detect all guns, but then sometimes it identifies an object that is not a gun as it being a gun, well, that's not that big of an issue, right? So that's somebody who just needs to go back and check, and we can apologize to the people and move on, right? But the two are completely different, and I hope that you can see the nuance here and also the nuance in how to address each one. All right, so in here, again, going back to these algorithms not being able to generalize to all data sets, we are able to, when we hear that an intelligent camera is 98% accurate at detecting guns, well, what type of guns? There are hundreds of types of guns, and we need to make sure to understand what training data was used for that specific algorithm, so that way we can understand what type of objects can be detected, right? And then going back to the low accuracy, when we talked about 98 or 97% accuracy, yes, that seems like a very high number, but when it comes to healthcare, when it comes to security, that could not, maybe it's not high enough. So again, for our educators, what does it mean? Well, it means that context is very important. When we say that an algorithm is 89% accurate, it might be good or very good in situations that are where the context is very low risk. But when we're dealing with the context of high risk, when people's lives are at risk, then maybe an 89% accuracy is not high enough. And that's something that we need to stress on. So it's not enough to understand what an algorithm can do, but it's also important to know how to apply these methods to the right context and how and what does that mean. All right, so our last set of examples I'm going to be talking about is the multispectral, and what I mean by that is several models running at the same time. So we have some models that are looking at social media. Those models analyze text, they analyze image, they might analyze video as well. So those are models that incorporate several types of analyses at the same time. Now, this is all great, but what I want to focus on is the privacy and security aspects, okay? So again, these tools are very beneficial. And we see the benefits of these tools in several domains today. But one thing to remember is there are privacy issues and there are security issues. Sorry, there are security issues. So for our educators out there, please, please, please incorporate ethics. Incorporate ethics into the courses. Whenever you're teaching about analytics, whenever you're teaching about AI, yes, right now the tools are becoming more and more simple. They're simpler to use. It's very easy to just buy a tool, plug and play, right? This is wonderful. This is great. But is it ethical? And moving forward, is it legal, right? The regulation, like we have mentioned, is moving forward to allow these tools to be used in several domains. However, the regulation is also looking at the privacy issues, at the security issues, at the biases issues. So we know, for example, that the facial recognition works very bad. It doesn't work really well when it comes to African Americans, right? And we have heard about the cases where we have African Americans that were wrongly identified as being thieves, for example, in a convenience store, etc. And that's when the algorithm messed up. That's when the algorithm was wrong. That's when that accuracy level was not at 100%. So those are all issues that have to be addressed in the classroom. Those are all issues that need to be addressed in the practice. So whoever is applying these, whoever is putting these into practice, these tools into practice, please be aware of the problems, of the ethical issues, of the regulation, the privacy and security issues. Because again, like Danielle mentioned, there's always the risk of losing that data. So we have heard about cybersecurity attacks being or increasing during the pandemic. We have heard even about the Zoom bombings, right? Well, similarly, there are a lot of people right now, because they know that telehealth is booming, they're trying to get into that data just because they know that they can get a lot of monetary rewards by acquiring that data. So it is very important to keep the security in mind, the privacy of our consumers, of our patients in mind, and also the ethical aspects. We don't have to wait for it to be illegal to share people's private information. We just need to do the right thing. All right, so with that, I give it back to Jillian. Jillian, do you want to talk a little bit more about the Center of International Business and Education Research?
Hi, sorry, I was just forgot to turn off my computer. There was a couple of questions and I wanted to make sure that you were able to.
Sure, so if you want, we can address the questions first and then we'll go ahead and talk about cyber.
Yeah,
right.
Thank you. Sorry about that.
All right, no problem.
All them on there. I want to make sure that everybody.
All right, so in here I get, how do we build a model which is 100% accurate? So unfortunately today we can't. We cannot build a model that's 100% accurate. We're not there yet. We're working towards that. We are trying very hard with different types of methods, and we are moving very well. I mean, we have some models that are that reach a 98% accuracy, but as of today, we are not able to have a model that's 100% accurate. Let me read another question. So in here on the image accuracy, I think it needs to be established by the SLAs collected from the customer. If the customer wants 99.999 accuracy, they will need to have budget for that accuracy to meet SLA between the vendor and the consumer. Yes, transparency is very important, right? That is great. If we're doing image accuracy, and we have a specific accuracy level, we need to at least be able to let the consumer know, right? And if the consumer doesn't agree to a lower accuracy level, to an 89% accuracy, well, they can opt out. We need to give them the option to opt out, which is also very important, right? So in a lot of the contexts, the consumer does not have an opt-out option, right? So when we go to airports or today, there is no opt-out. I mean, we're there and the video is recording and the algorithm is running. With the police, and that's what triggered a lot of the protests, those cameras were running, especially in California, and they were using these algorithms even though the accuracy level was low and the bias was really high. Right, so whenever we have these types of issues, we absolutely need to give the consumer an opt-out option. All right, in here, I have a few questions. I only see, okay. How do these telehealth approaches address effectiveness of overall healthcare and the financial sustainability for healthcare providers? This is a great question. So telehealth approaches today try to address the immediate need. And again, remember, we have seen adoption of telehealth booming or accelerating right after during the pandemic. So as of today, I'm afraid that we're not able to address the overall healthcare. But moving forward with these tools, hopefully we'll be able to reach a much better level. So if we have the sensors in place, if we can do ultrasounds from home, then telehealth will be great. Now, as far as financial sustainability, that's the bill that just came out in the US that increases the reimbursement rates for the doctors. So that would help tremendously, because before in the US, we did have a telehealth. Telehealth was allowed. It was just not being reimbursed well enough. So the doctors were reluctant to use it. But today, that reimbursement level is much higher. We also have a reimbursement level for the use of remote monitoring. So tools like heart rate monitoring devices. So the doctors are being reimbursed for that as well, because those devices are now sending alerts or notifications to the doctors. So the doctors need to take the time to review those, right? And right now there is a mechanism for them to be reimbursed for that as well. I mean, we're not there yet, but we're working towards that. All right, so in here, for getting challenges into the special cases, we can train the machine by giving loads of input related output data and made it to react to that special case, so deep learning algorithm may be used. Definitely, yes. So in here, what Archana is saying is we can train these algorithms by giving it more data. Now the problem is, in practice, we might not have that data. So, and that's the issue. So definitely, these algorithms are data hungry. The more data we give them, the better the results are. But in practice, unfortunately, we might not have all of the data that we need. So for example, for rare diseases, deep learning performs really, really poorly. But we're also working towards that. So deep learning algorithms are also advancing. We're hoping that they would be able to generalize sometime soon. All right. Okay. So this one's for Danielle. Fascinating, or this is for you, Danielle. Let me go back from Maria. It says fascinating early start of your digital health journey. Question number one, given the early start of digital health in Brazil, is it customary for doctors to go digital first in Brazil? And then the second question is, have you seen clinical workflow modifications based on digital health that we should be implementing here in the US? This is a great question. So is there, do doctors go digital first? And two, is there anything that we can learn from Brazil and apply it here in the US when it comes to digital health?
I think that everything is starting to happen now because of the pandemic, right? So I don't know exactly what they mean by going digital first, but my understanding is like start working with having a first consultation. Would that be the case? Or I don't know, or maybe start working online instead of like setting up an office and only work online, right? I don't know exactly what the case is, but yeah. One thing that was going on already for a long time in Brazil was doctor-to-doctor telemedicine. So that was allowed. So the doctors were not allowed to have a first visit with a new patient online, but they were allowed to supervise or guide other doctors from a distance. And in Brazil, we actually have a lot of experience with that. And that's in Brazil. It has actually has two health systems: a public government-run one and a private one. So the government one was actually more advanced in that regard because of those doctors in the less developed areas of the country. They will many times consult with specialists in the big cities through remotely, right, through a telemedicine platform. So with that, we have a lot of experience, including tele-ophthalmology and like advanced exams, not only conversation, not only looking at the patient, but actually running exams from a distance, the whole radiology thing, it was going on already in Brazil, like reporting exams from a distance, and also those more complex exams, which is harder to do, right? You have to operate a machine like an ophthalmologist, in like an optometric, or so to speak, machine from a distance and tell if the patient has any eye condition or not. So many doctors were, in a sense, digital first because they only worked digitally, like in those, providing assistance for those doctors from a distance. But only now doctors are able to go digital first in the sense of having a new patient that they never saw before coming and making an appointment. Yeah, that's only now starting to happen in Brazil.
All right, so it's not.
That was another part of the question too, right?
So the question is, what can we learn from Brazil that we can apply to the U.S. as far as?
Yeah, I think that what Brazil could be like a bringing in terms of experience is population management. Like the government run system in Brazil follows the British health systems, the NHS. So in that, which is something that I think the US really lacks. The US is really awesome when it comes to medical technology and when it looks to the individual patient. But when it comes to population management, I think the US is really behind. I mean, there was the whole ACO initiative, and we have patients that are being followed by specific doctors and clinics, but that's not systemic still. While in Brazil, in many cases, you are better off being treated in the public free system than in the private system, which is quite expensive. Just because of that. Just because, I mean, you might have the best doctors. I mean, what is the best doctor? What makes a doctor the best doctor? That's like a whole
that's a
separate
different
issue, right?
Exactly.
But you might have access to the best facilities, the best doctors, the best technology, whatever you believe is the best, right? The best healthcare brands, but you will not be managed by anyone. You are on your own, basically. While in the publicly run system, it's different. It's more like Canada, like more England. There is someone looking after you, and depending on the case, you're better off there than in the private system. And the way I see it here in the US, even though you have Medicare, it's always privately operated. So you're never taking care from a systemic point of view. You're always managing yourself.
The system is very fragmented and the patient has a big responsibility. So when we say patient-centric, we do give the patient a lot of power, but that means that they get a lot of the responsibility as well. Yes. Yeah. So yeah, well, thank you so much. And I believe there are pros and cons to each. So, but this is wonderful. It's great to at least try to get everything that's good from abroad, right? What can we learn? What are the lessons that we can learn
in
from
that regard? Brazil is a very good experiment, I would say, because we have about a quarter of the population that have access to private healthcare. And that quarter of the population consumes about half the money in the healthcare system, while we have 75% of the population using the other half of the money in the public system. And you can compare them right on. It's not like you are comparing different systems in different countries. We actually have the two systems in the same country, which is quite interesting, I think.
All right, that sounds like a new research project. All right, for our PhD students with us here, let's plan to talk to Daniel right after this.
I can help with that. Yeah.
All right, wonderful. Thank you. So let me just a couple more. Do we have time, Jillian, or do you want to wrap up?
I was just going to say something really quickly, but then if you have a couple more questions that you want to address, definitely, I think, if you're available, I'm available.
Let me just address them real quick. So this one is about text AI, and the question is, how does AI text analysis understand context? And I love that question just because the new deep learning algorithms do take context into account. So instead of looking at the sentence by itself, and I don't know if everybody is able to see my hands, we look at the whole spectrum so we can widen the range of the words that we are looking at, and we can also feed it a section. So for example, for provider documentation, we can, for example, say this text was in the plan section. So the algorithm knows to address that sentence based on where it was found in the documentation, which is wonderful. So yes, we are right now today working towards including context into our AI text analysis, and this is very exciting. We're getting there. Next question is, AI is imperfect. What if it makes a mistake? That's why ethics procedures need to be in place before any installation of this technology. Completely agree. It is imperfect, and we need to have ways to, one, mitigate all the problems, two, involve ethics in there. So we have to let the consumer know that, one, we're using AI, and two, that there are risks with AI and limitations. They have to.
Can I add to that?
Agree or disagree to using that. I'm sorry, Danielle.
Sorry,
you have
Lina, sorry to interrupt, but when it comes to AI, it's not like the doctors are not are free from errors, right, and mistakes.
Good point. Yes.
In healthcare, it's all about sensitivity and specificity. So
True.
every exam, every lab, every result you have, and every doctor you go to, it's never going to be 100%. It's always about sensitivity and specificity, and that's the same for AI.
Yes, definitely. Human error is definitely a thing, and also biases come from us. And the truth of the matter is that these algorithms have learned these errors, a lot of these errors, from us humans, because we feed it our historical data. So the biases that are in the AI algorithms today, they are inherited from human behavior, unfortunately. But if there is a way to resolve that, if there is a way that we have right now to address it, why not? Right? Let's not have that stop us, and let's try to do better, right? So in here, I guess this is one last question. We can use the line follower bot based Crowley, which can have the oxygen measurement meter, temperature measurement meter, and other small devices, which can go to patients and collect data. And the collected data can be analyzed, and the medicine or help can be provided to patients. During this COVID, this can be helpful, definitely. So I guess that was a comment. We can definitely collect all of the data, and it is being done right now. So we have sensors placed everywhere, and we are analyzing that data, and there are several studies that are doing that as we speak. So yeah, we're gonna have more data, and we are improving our algorithms, and this is great. All right. I guess we covered it all.
Yeah. I wanted to say thank you so much for Dr. Boyad and Danielle Branco for joining us today and really shedding some light on this very interesting field that is innovative and is ever changing, especially post-COVID. I definitely learned a lot about it. And I thank everybody who has attended the webinar, and I hope you found it helpful and that you've learned something new today. Please keep an eye out for other webinars that we'll be hosting. This is part of a 4-part series. And, please learn a little bit more. If you're not familiar with our center, please feel free to visit our website or send us an email. We are a resource. We're one of 15 cyber programs throughout the US. And we're really just a resource to help the U.S. become even more competitive in international business. And, we have lots of opportunity available for professors and for students and the community to get involved and learn more, and also for funding for scholarships and things of that nature. So please, feel free to take a look at our website, see all that we have to offer, or email us, and I'd love to talk about any ideas that you may have that are related to our initiatives.
All right, wonderful. Well, thank you so much. Thank you again for everybody who attended. Thank you, Danielle, so much for joining us. This was great. Thank you.
Yeah.
And thank you, Jillian, for organizing this. Thank you.
Thank you. It was wonderful. I really enjoyed it.
All right. Thank you very much.
Bye-bye.
Jillian, can we have the recording of this after?
Yeah, definitely.
All right, please.
If anyone has any questions afterward, feel free to, you can send it to the email below, and I can, give them over to you all as well. But yeah, we will definitely share that.
All right. Wonderful. Have a great day, everyone.
Thank you.
Bye.
Take care.